What's up, guys? Dr. Chris Park here, and today we're going to drink a little coffee and talk a little addiction. In today's video, I want to cover transitioning from methadone to buprenorphine. Talk to a friend today about this, okay? So let's say you're taking methadone. Maybe you're taking it off the street. Maybe you're getting it from a clinic, and that's your only addiction. That's your only opiate. No other drugs, no meth, no IV drugs, no etc. Okay, and you want to change to buprenorphine. So the first goal is to taper the methadone down to 40 milligrams a day or less. Okay, so you can taper that however you need to do that. Okay, however your doctor decides to taper you. So you get down to 40 milligrams a day, and then I will typically then have them stop the methadone, and they will go 48 hours with no opiates, no methadone, no opiates, okay? And they'll be in withdrawal. And I will evaluate them and do a withdrawal assessment and decide if it's time to start buprenorphine, okay? And then if we feel like it's an appropriate time to start it, I'll start with a low dose. Now, it kind of depends on if the patient, if they have insurance and we can get them the Suboxone strips, or they can afford that or whatever, we can cut those strips very low. A lot of times though, especially the initial transition, I'm using just plain buprenorphine with no naloxone in it. But the problem is those are tablets, and those are hard to break up into very small amounts, but you can do it. I've got plenty of people who do. So we will try to get like a 1 milligram, maybe a 2 milligram dose, sublingual, and we'll start there. And then we'll just kind of, may redose later during the day, or we may, the next day we may go up on the dose. We want to use the lowest effective dose. I mean, it's like a no-brainer, right? More is not always better. And if you struggle with pill addiction, you already know that is true. So we want to use the lowest effective dose, but we want to control the cravings, and we obviously want to control the withdrawal, and we don't want to push anyone into precipitated withdrawal. And we want to monitor side effects, etc. So this is all, the kind of things that we're doing when we're transitioning someone. And so that's the basics of it. No methadone for 48 hours. We do an opiate scale. The patient should have already tapered to 40 milligrams of methadone a day. Are there other ways to do it? Yeah, I'm just telling you that that's my basic kind of rule of thumb with methadone. And just because it's 48 hours doesn't mean I'm going to start the buprenorphine, because they may not be in enough withdrawal. I use that kind of the Cal scale. I don't do it 100% by that scale. I've just been doing this long enough that I just kind of have my own system of scoring their withdrawal, and then we start the buprenorphine and go from there. So if you have questions, comments, whatever, leave it down below. Just remember, guys, talk to your doctor. Don't take advice from people on the internet or YouTube or anything like that. Talk to your doctor. Find out the right way for you. And remember, medication is not recovery, okay? Recovery is the other thing that happens. Medication makes recovery easier. But recovery is about fixing those relationships and working on the stressors in your life, and the anxiety and the depression and the things in your past that have kind of these deep roots that you've kind of worked through or worked around or tried to forget your whole life. Recovery happens with everything else. Yeah, it's not the medicine, but the medicine makes the recovery easier. Okay, so please don't just take the medicine. Get into recovery, and that might mean 12 steps. That might mean you and a counselor. That might be you and a priest. Whatever it is, do the recovery, guys. I cannot stress that enough. Okay, and so talk to your doctor. Get into a recovery program. If you need to transition from methadone to buprenorphine, this is kind of my routine. You can discuss with your doc to see if that makes sense for you. All right, guys. Hope you'll have a great day. Drink some coffee. Love your neighbor. Peace.